Hey everyone, so today we're going to read about hypolipidemic drugs. So let's quickly start about the mechanism of action of the drugs. So what happens when we ingest any of the fat-rich diet? It consists of cholesterol and triglyceride most commonly. So in the intestinal lumen we have cholesterol and triglyceride. They both form a ball, and that is called as cholesterol esters. Cholesterol joined by cholesterol esters and triglyceride, and they form chylomicron. So this is the lipoprotein, right? So after that, from the intestinal lumen, there is a receptor called as NPC1N1 in the intestinal lumen that helps in the transport of the chylomicron from the intestinal lumen into the blood vessel. So we have chylomicron lipoprotein, which is transported by the NPC1L1. So after that, chylomicron meets another lipoprotein, a friend of its, called as VLDL. Now where does this VLDL come from? This is synthesized in liver. How does it synthesize? See, HMG-CoA, with the help of HMG-CoA reductase, gets converted into mevalonate, and mevalonate gets converted into cholesterol. Okay, so this cholesterol then further binds with triglyceride. Where does this triglyceride come from? See, this is the adipose tissue. The triglyceride is converted into free fatty acid with the help of hormone sensitive lipase. Free fatty acid goes to the liver, and free fatty acid then converts into triglyceride. Triglyceride reacts with cholesterol to form VLDL. So these VLDL and chylomicron then moves further, and the places where it has LPL, lipoprotein lipase, there the triglyceride component of the lipoprotein gets absorbed where the cholesterol is remaining, and the VLDL converts mostly to the LDL. LDL is a bad, and that causes atherosclerosis, so it remains in the cells and causes most of the damage. So extra LDL is taken by the liver, so that there is no harm such as atherosclerosis and either further damage. And extra LDL also gets converted in HDL, which is a good lipoprotein. Okay. Bile is also made in the liver. So what happens? It helps in emulsification of fat, and 5% of it is excreted, and the remaining 95% is again absorbed by the liver. So what happens? Let's talk about the drugs now. So if it use NPC1N1 inhibitor, that is ezetimibe, it will not help in the absorption of chylomicron, that will not form the LDL, and further you know. The second is statin, which inhibit HMG-CoA reductase, will not form cholesterol, and that will not form the LDL. The third is PCSK9 inhibitor. PCSK9 will degrade the receptors, and we don't want to degrade, we have to increase the LDL receptors so that more LDL can come to the liver, and there will be no problem of atherosclerosis. So example is less synthesis inclisiran and monoclonal antibody elicrocumab. And the third is the niacin, which inhibits the hormone sensitive lipase, that will not form free fatty acid, that will not form VLDL, right? And the fourth is the PPR gamma activator, which will actually take up the triglyceride from the chylomicron, and that will decrease the hypertriglyceridemia in the blood. Okay, and the one next is bile acid resin, that will inhibit the taking up of the bile from the blood to the liver, so there will be more synthesis of bile, and more synthesis of bile can only take place by taking up of more LDL. So more LDL receptors will also increase. Thank you.